911. Okay. What's your address? Okay, hold on. What's your address?
The firefighting service as we know it is under siege. As part of an American healthcare system in a state of disruption and rapid change, the fire service faces major threats to its emergency medical response business. The fire service, like every other healthcare organization in America, must adapt to the realities of the healthcare spending crisis and national healthcare reform. Welcome to FD Cares, the next generation of fire department healthcare services.
If you're part of a fire-based system that delivers emergency medical services within your community, and you're considering offering a community paramedic program or a mobile integrated health program, then the information contained here is for you. If you're not considering offering these type of community outreach programs, you really should be, because if you don't, the services that you're offering today could be in jeopardy in the future.
The United States spends more money on healthcare than any other country in the world, over 17% of GDP, and nearly twice as much as any other economically developed nation. Fire departments are part of this system. As U.S. healthcare costs skyrocket, the rules are being rewritten. This affects us all. In 2010, the federal government enacted the Patient Protection and Affordable Care Act. The PPACA has three primary aims. 1. Ensure every American has financial access to care by requiring that every American purchase health insurance. 2. Reduce the costs of care by penalizing providers for the delivery of unnecessary and avoidable care. And 3. Improve the quality of care by financially rewarding providers for the value of services delivered. These provisions are changing the way healthcare services are accessed, paid for, and delivered. Universal health insurance. The mandate that every American purchase health insurance moves the U.S. towards a national insurance-based healthcare system, which threatens the financial stability of fire departments and drives non-emergent medical calls out of the 911 system. Universal health insurance puts American fire department revenues at risk. Under the PPACA, every individual is required to purchase health care insurance that specifically provides coverage and pays for emergency medical transport. With this health insurance tax, voters may be less likely to support existing or additional property taxes to fund fire-based medical services that are already covered by medical insurance.
The Affordable Care Act requires that most Americans obtain health insurance or pay a penalty when filing their income tax. What this will look like to many of our community members is that they're paying a healthcare tax and a property tax for a fire-based EMS system, which could appear to them as double taxation.
Universal health insurance also puts 911 call volume at risk. Historically, the largest percentage of medical aid calls to the fire department are from the uninsured and underinsured. Now that these newly insured have financial access to primary care and preventative health care services, they will increasingly move away from using 911 for their non-emergent health care needs. Financial penalties for unnecessary care. Financial penalties for unnecessary care will also drive non-emergent 911 calls out of the healthcare system. Currently, providing emergency care to patients with non-emergent conditions costs the U.S. healthcare system upwards of $38 billion a year. PPACA provides financial penalties for providers of unnecessary and avoidable care. In response, hospitals and health systems are implementing innovative programs like telehealth, hospital outreach, and transitional care programs, which redirect non-emergent patients away from 911 service to less costly, more appropriate services. Non-emergent 911 calls account for an estimated 40% of all fire department medical aid responses. As these calls are shifted out of the 911 system, fire departments may face the prospect of fire station closures and firefighter layoffs. Financial incentives for high-value care. Provisions in PPACA shift healthcare payments away from rewarding providers for a higher volume of services toward rewarding providers for a high value of services, where value is defined as health outcomes per dollar spent. Historically, the U.S. healthcare system's fee-for-service payment model gave healthcare providers a financial incentive to deliver more tests, more treatments, more visits. But the new value-based reimbursement model makes providers accountable for the outcomes and costs of care. U.S. fire departments, historically proficient at getting to patients quickly, determining their immediate healthcare needs, and packaging the patient for transport to an acute care facility, now need to increase their focus on delivering value. That means better identifying and serving their patients' long-term healthcare needs, connecting patients to the right community and healthcare resources, and partnering with hospitals and health systems to improve outcomes and reduce overall costs.
Every sector of the healthcare industry is remaking itself in response to healthcare reform and to economic and market forces that are demanding better value. The residents in our community are also demanding better value of the fire department.
In order to survive, fire departments must transform their operations to improve the efficiency and value of their services, partner with other healthcare providers to diversify their revenue streams, and expand their reach into new types of healthcare services to address unmet patient needs.
And what I want you to do is I want you to take your quad.
What are the needs of non-emergent 911 callers? Why don't they utilize healthcare resources efficiently? Typically, this population is uninsured or underinsured. Many experience significant barriers to healthcare: low health literacy, behavioral health, geographic location, lack of financial responsibility, and a host of other socioeconomic factors. They often struggle with multiple chronic conditions such as obesity, heart failure, emphysema, diabetes, coronary artery disease, asthma, hypertension, cancer, depression, and anxiety. But they are often confused about where to access care and for what conditions. Many have become habituated to using 911 and the hospital emergency departments for all their healthcare needs, and as a result, they often get shuffled from provider to provider with limited follow-up, coordination, and continuity of care. This population is lost in the chaos of the healthcare system, trapped in a cycle of unnecessary and avoidable use of emergency care.
Firefighters responding repetitively to the same patient for the same thing over and over is frustrating to them. These patients are also being transported repetitively to emergency departments. So emergency department and hospital directors need to address their non-emergent high utilizers in a different manner.
They are part of the 10% of Americans who account for nearly 2/3 of all healthcare spending. Though many are designated by insurers and health systems as high-risk patients, their needs largely remain unmet. Now, with assistance from PPACA, these patients are beginning to access primary care and preventative care, some for the first time in their entire lives. A whole new market of healthcare services is expanding to meet the healthcare needs of this population. Retail clinics at stores like Walmart and Walgreens are opening their doors. Urgent care and no-wait care clinics like Zoom Care are popping up everywhere. Telehealth, phone-based, and webcam-based healthcare visits are becoming the standard for triaging non-emergent conditions. Hospital networks are converging into health systems and developing an integrated, holistic approach to care, opening a robust network of urgent care, telehealth, and retail and primary care clinics. But despite access to insurance, primary care, and preventative care, utilization of these new healthcare services remains relatively low. People are creatures of habit and cautious of innovation, particularly when it comes to healthcare, where trust of the organization and the individual healthcare provider are paramount. Fortunately, fire departments are among the most trusted organizations in the country. In Gallup polls, firefighters consistently rank among the top 2 most trusted professionals in the U.S. And with the most costly patients already habituated to using 911, fire departments have an opportunity to capitalize on their strategic position in the market and transform the way fire departments deliver healthcare to address unmet patient needs.
We believe that fire-based organizations should continue to have the members of their community utilize the 911 system for both their emergency and non-emergency needs. What we advocate is that you identify your non-emergent needs and you handle those in a more cost-effective and more efficient manner, and that you tie in with the broader healthcare system. The way to tie in is to be the healthcare system navigator and make sure that patients are getting to the appropriate locations and that you're meeting the triple aim of the Affordable Care Act.
In partnership with the Kent Fire Department Regional Fire Authority, FD Cares has developed a phased implementation that improves the value of fire department healthcare service delivery. Phase 1, optimize fire department response models for non-emergent 911 callers using data-driven solutions. 2, expand the scope and type of fire-based healthcare to include non-emergency medical services. And 3, integrate these services into the broader healthcare system and generate new revenue streams to fund operations.
Now, some communities will have different demographics and different resources available, and your program will have to be slightly adjusted to meet those needs, but the core of the services that you deliver will be the same from community to community. We do believe that EMS will look different, just as the rest of the healthcare world is going to look different in the next 5 to 10 years. The question to ask yourself is, how do you want your organization to look as you move forward into this new healthcare world?
Fire departments that adopt this approach will achieve improved response efficiency, sustainable growth, and expansion into the delivery of non-emergency medical services. Discover new revenue streams to fund their non-emergency medical service operations and ensure that local residents receive a better value of care, lower costs, better experiences, and better health outcomes. Fire departments like these will survive and thrive.
If you have more interest, please contact us at 253-856-2273 or contact us through the website at fdcares.com.